I'm joined by Dr. Lisa Cassileth, a plastic and reconstructive surgeon who has pioneered the one-stage breast reconstruction surgery for women with breast cancer. Please welcome Dr. Cassileth. Tell us what this one-stage breast reconstruction is all about.
Traditionally, breast reconstruction is performed right at the time of mastectomy, hopefully, where the general surgeon or the oncologic surgeon makes a large scar in the chest, in the breast.
We actually have pictures of that.
Oh, wonderful.
That's a more traditional, behind me here is a more traditional incision. That's how they do it.
Now,
and they put expanders in there, don't they? Then that comes later.
Exactly. Yeah. So expanders can be placed underneath the skin of the mastectomy flap. I actually brought one with me to show you. And so this is an expander. It goes in flat and it's got a port. This is how it's filled. It's placed underneath the skin. And then the needle is actually stuck through the skin to blow this up over time. About 50 to 60 cc's or more is placed at week intervals for potentially months at a time.
So things are just expanded under the skin. Does that hurt?
Exactly. It can hurt a great deal.
Okay. Instead, you've developed this procedure where it's all done in one step at the time of the mastectomy.
Exactly. So a smaller incision is used.
Is this the one step right here? Is on the left?
Both sides here are bilateral mastectomy flaps. Bilateral mastectomy reconstructions.
Wow. Both of those have been reconstructed breasts.
That's right. And so the difference is that the scar is smaller. In most cases, or many cases, we save the nipple and the areola. And then you skip having to have the expander placed at all. The implant is placed in an internal bra.
So it's all done right at the time of the surgery. When they had the mastectomy, they wake up, they haven't lost their nipple, they haven't lost their breast, they don't have that ugly scar. Is there anything different about it in terms of pain or recovery?
Well, what I've noticed is the patients do better. They have less pain. They have easier time moving.
So it's
and of course,
easier.
They don't have multiple procedures.
Today is the day I'm doing my one-step double mastectomy. So I'm going to go under, we're going to take the girls off, and I'll wake up with new ones.
So it's been hollowed out, and really it's just an empty shell. So this is when I take over. Basically, I'm going to put the implant under this muscle here and in the internal bra, which I construct. So now the sizer is in, the Allotron bra is in. So I'm going to fill this up, see what size she needs, and make a final decision about the implant where she needs. Hi, cutie. You up at all? Guess what? You're finished. And guess what? Your lymph nodes were clean, no cancer. No.
I cannot believe that operation we were just watching was just 2 weeks ago. Look how fantastic you look.
10 days ago.
I can't believe it.
10 days ago.
I cannot believe that. It's incredible. And cosmetically, you feel really good about it, I bet?
I feel like my normal self. And that was my biggest concern, was waking up and feeling deformed, feeling butchered. And I woke up and I looked down and I had breasts. And they're actually better than my last ones.
They're better. You got a new pair. You got a better improved pair. Now, Victoria, would you recommend this to other cancer patients?
Absolutely, absolutely. It saves you time, it saves you pain, and it saves multiple procedures. And you wake up feeling like a woman and feeling normal. And it's so important because it's such a mental impact to get your breasts removed. I couldn't be happier. I'm still in shock about the whole thing.
Any messages you have for women out there?
Explore your options, ladies. I had no idea that this procedure even existed, and thank God it does.